Hi everybody. I had a CMC basal joint replacement in my left thumb. I really need it in my right thumb, as you can tell by the bone here, but I don't get any pain in my right hand. So I opted to have the left hand done because the pain was so severe I couldn't even button my pants. I'm about 3.5 weeks out, and this is my $500 custom-made splint. I'm allowed to move the top part of my thumb. They don't want me doing this, or this, grasping things. So my scars are minimal. This is the scar right here, where they went in, they removed the trapezium, and they took that bone out. And then this is the scar, very small, where they took the flexor tendon, and that's actually packed in here right now, and then they anchor it. I can tell you that I'm not supposed to have my brace off. I am supposed to wear this. I'm supposed to start physical therapy, but they don't want you to start it until you're 4 weeks out, which won't be until Friday. And I think I'm probably doing a whole lot more than I'm supposed to be, but I have way less pain now than I had prior to the surgery. So if it's recommended, I have no problem. I don't know that I'm going to get my right hand done ever. I will have to completely lose all function before that happens because I'm right hand dominant. But that's where I'm at, and I think I'm healing nicely, and it's not as scary as some people think. I have to tell you that what really helped me was watching all the YouTube videos. I watched the surgeries, I watched the recoveries, so I knew what I was in for. Syracuse Orthopedics and Sports Medicine did my surgery. Dr. Lemley, phenomenal. That's it.